The doctor has put in an order for Coumadin 5 milligrams PO daily for the diagnosis of atrial fibrillation for my patient Linda Belcher. The order is signed by the doctor. My first medication check is done. Going to the Pyxis to my second medication check. I'll pull an oral dose of Coumadin 5 milligrams. It is not expired. Second medication check's done. Going to see my patient. Knock, knock, knock. Hello, my name is Raylen. I will be your nurse today. I'm here to give you your Coumadin medication for your atrial fibrillation. This medication prevents blood clots that may acquire in your body from your diagnosis of atrial fibrillation. We did perform a PT and INR blood test before to ensure that you weren't bleeding excessively and the medication wouldn't have adverse effects. But the side effects of the medication are excessive bleeding. So if you do have blood in your urine or in your stool, or if you have an uncontrolled bloody nose, please let us know, okay? And we will be giving you a whole education packet on this, and we'll be going over it more in detail. But for now, we'll get started. I'll give you your dose. Have you ever taken this medication before? No? Okay, yeah, it's for your new onset AFib, so this is a way of treatment. Can you just verify your name and date of birth for me? Linda Belcher, 9472. And do you have any medication allergies? No? Okay, good. All right, and do you have any problems swallowing? No? All right, can you just take a sip of water right before we get started? Okay, and I will scan my medication, open it up, put it in. All right, here is your dose. Awesome. And let me just chart that I gave you your medication. Just going over some more education about this, since you will be discharged on this medication. It can be a very serious drug, so just make sure you're not taking any other medications, over-the-counter medications or herbal supplements without talking to your doctor first. We will give you a packet with everything that may occur while taking this medication, what could cause it to be worse. Make sure that, like we did today, we did take your PT and INR level. You will have to regularly go get your lab test done for that. The normal range would be about 2 to 3. Also, no excess of leafy greens. If you do eat salads now, that's awesome. Just don't eat in excess of them because they do contain vitamin K, which is an antidote for this medication, okay? Also, to limit the chances of you bleeding, just use a soft toothbrush, don't floss, and make sure you're using an electric razor to limit that, okay? Also, no drinking alcohol. It does increase the effectiveness of the blood thinner, okay? Also, if you are having any excessive bleeding, like I was talking about, a bloody nose that you can't control, go ahead and talk to your doctor about that immediately, okay? Because you don't want to start bleeding excessively, and then that would cause more serious problems, okay? All right. Well, here's your call weight, and is there anything else I can get for you? No? Okay. Call me if you need anything. The doctor has put in an order for metformin 500 milligram PO daily for the diagnosis of diabetes mellitus for my patient Anna Kendrick. The order is signed by the doctor, so my first medication check is done. Going to the Pyxis to my second medication check. I'll pull an oral dose of metformin 500 milligrams. It is not expired. Knock, knock, knock. Hello, my name is Raylen. I will be your nurse today. I'm here to give you your dose of metformin. Before that, we will get your blood sugar. We just got your blood sugar tested, and we did get your labs done to make sure to check your kidney functions, okay? And then did you order food? Yes, you did? Okay, it's on the way. Awesome. And have you taken this medication before? No? Okay, let me just tell you some side effects about it. It does cause some stomach issues, nausea, vomiting, diarrhea, some abdominal bloating. That's why we're taking it with food, to kind of lessen those effects. Also, lactic acidosis is a side effect, but we will make sure that we are checking your blood levels to ensure that you do not get to that point, okay? All right, and this medication does have a sort of metallic taste to it, but it should go away, okay? All right, so can you tell me your name and date of birth? Anna Kendrick, 4580, awesome. And do you have any drug allergies to penicillin and sulfa? Okay, what happens there? You get a rash? Okay. And do you have any problems swallowing? No? Okay, do you mind just taking one drink for me? Okay, that go down okay? All right, scanning my medication. And here is your dose. Perfect. Let me just put that in my documentation that you got the medication. All right, so just some education about this, which you'll be going home with a packet. Take this medication as instructed. This is not a cure for your diabetes. It just helps with lowering your blood sugar. So you will have to make some lifestyle changes. We start getting exercise, being on a healthier diet, and this will probably be a long-term therapy for you, okay? And then report any signs of hypo or hyperglycemia or lactic acidosis, any of those. Make sure you're reporting those to your doctors so we can ensure that you're getting the correct dosage and that it's actually working, okay? And make sure when you're at home, you're monitoring your blood sugar regularly, and we will be coming in with all the supplies and showing you how to monitor it, what is a good level, and what is too high or too low, okay? And then make sure that if you are taking any other medications, over-the-counter prescriptions, anything of that, make sure you are talking to your doctor first before starting them, because it may cause a drug interaction with this medication of metformin, okay? All right, was there anything else I can get for you? No? Okay, well here's your call button, and let me know if you need anything. The doctor has ordered 5 units of regular insulin and 5 units of NPH insulin sub-Q now for diagnosis of diabetes mellitus for my patient Natalia Romanov. The order is signed, so my first medication check is done. Going to the Pyxis for my second medication check. I will grab out the vials for the regular and NPH insulin. They are both of the dates are written on them as to when they were open. And I will grab all my supplies and prepare the mixture. Okay. And this one vial will be used as both. So I want to do clear, then cloudy. So I will first sanitize my hands, clean the tops of both of them, and I will inject 5 units of air into the NPH. Okay, and then I will inject 5 units into the regular of air, and then I will draw back 5 units. Okay, and then I will go to my NPH and draw back 5 units, making sure not to overdo it. Okay, and I will do a one-handed cap. Okay, and then I will take these as my medication labels. So then I have them, so I'm not walking around without any unlabeled medications. And I will go see my patient. Knock, knock, knock. Hello, my name is Raylen. I will be your nurse today. I am here to give you your shot of insulin. We did check your blood sugar before, and we will need to give you your dose of insulin. And did you order food already? You did? Okay, just pull the curtain there. You ordered food, that's on the way. Awesome. Have you ever had insulin before? No? Okay, well this is just to help us lower your blood sugar since you are diagnosed with type 2 diabetes. And we'll make sure to give it within the food range, since there is some fast acting insulin in there, so we don't want your blood sugar to go down too fast, okay? All right, can you just verify your name and date of birth for me? Talia Romanov, 4/29. And do you have any allergies? No? Okay, perfect. So I'm going to inject this right into your abdomen, okay? It's just a little pinch, and then I will kind of talk you through what we're doing. So when you're at home and you have to do this, then it'll be a lot easier to make sure you can do it correctly, okay? All right, let me just sanitize, scan my medication in, put on some gloves. Okay. And then this will be my abdomen. I'm going to clean the surface. And since my patient's a little bit heavier, I will be able to go into a 90-degree angle. Okay, we're going to pinch the skin, go in, inject, and we're out. One-handed recap. Oops. Okay. And we will put a bandage over it. I will dispose of this in the sharps. Okay, how was that? Not too bad? Okay, yeah. So just with these, we're going to talk about the side effects of this. It could cause some hypoglycemia. You get chills, restlessness, nervousness, you're pale. That means you might need to eat something. Your blood sugar might be low. We also need to make sure that you are regularly checking your blood sugar, just like we're doing here in the hospital. We have, I know you have home health coming to bring you all those supplies and bring you some needles for insulin, and just making sure that you know that this is probably a long-term therapy. This will not cure your diabetes, so you do need to advocate for yourself by having a better diet and making sure you're exercising regularly. Otherwise, just making sure that you stay on top of this and you're checking your blood sugar and all of your other labs when needed, okay? All right. If you do have any other questions about administering the dose or taking your blood sugar, please let us know, but we will make sure to have all your proper supplies with you before discharge, okay? All right. Well, is there anything else I can get for you? No? Okay. Here is your call light, and then call me if you need anything else, okay? The doctor has put in an order with parameters for sliding scale insulin for my patient Joseph Smith with a diagnosis of diabetes mellitus. According to the point of care finger stick, my patient's blood sugar was 248. So according to these parameters, I will be giving 6 units of regular insulin sub-Q. And if the blood sugar is over 300 over, I will call the provider for orders. My order is signed. My first medication check is done. I will go to the Pyxis to pull out my medications. I have my dose of regular insulin. The open date is on it and it's not expired. And I will bring my supplies to prepare it. So I will clean the top off, sanitize my hands first, clean the top off, and then I will inject air into, oops, there we go, injecting air into the vial and pulling out 6 units. Okay. And a one-hand recap. And we'll bring this so my medication is labeled and I'm not walking around with unlabeled medication. Knock, knock, knock. Hello, my name is Raylyn. I will be your nurse today. I'm here to give you your dose of insulin. Your blood sugar was 248, so doctor's requirements are 6 units. Have you taken insulin before? Oh, you have? Okay, we'll just go over some side effects together. It would be hypoglycemia, where your blood sugar is too low. If you're feeling cool and pale and nervousness, or if your blood sugar is too high, which is hyperglycemia. If you're feeling flushed, you have to pee a lot, stuff like that. Making sure you're letting us know of those symptoms and letting your doctor know for when you're discharged, okay? So I'm going to administer this in the abdomen. Can you just verify your name and date of birth for me? Joseph Smith, 6'3", 1984. Awesome. And do you have any drug allergies? No? Okay, perfect. Let me just scan the medication in, sanitize my hands, and we'll do it. You want the right or left side? The right side. Okay. And coming over here, I will already scan my medication. I will clean the area, and since I have a heavier patient, I will do a 90-degree angle. Okay, and inject, releasing the skin, one hand recap, and putting a Band-Aid on it. This will go into the sharps. And let me just document that I gave you that medication, Mr. Smith. All right, awesome. So just making sure you know that this is not a cure for your diabetes. This will be a long-term therapy, so we need you to start getting some exercise, being on a healthier diet to ensure that you're maintaining your blood sugars. And since we're doing the sub-Q injections now, we'll do some teachings on that, making sure you're administering right and you're rotating spots around your abdomen. And you know the symptoms of hypo and hyperglycemia, so if those happen, make sure you're telling your doctor and make sure we know, okay? All right, awesome. Was there anything else I can get for you? No? Okay, here's your call button, and let me know if you need anything. The doctor has put in an order for Atlantis 10 units, sub-Q, QHS, meaning at bedtime every night, for my patient Sheldon Cooper for his diagnosis of diabetes mellitus. The order is signed, so my first medication check is done. Going to my second, I will pull out my medication. The open date is on it. It is not expired. And I will prepare my medication. Okay, and we'll sanitize my hands first. I will wash off the top, and I will inject some air into the vial and turn over and pull out 10 units of Lantus. Do a one-hand recap. Awesome, and bring this label. So my medication is labeled. Now I'll go see my patient. Knock, knock, knock. Hello, my name is Raylan. I will be your nurse today. I'm here to give you your dose of Lantus. Have you taken Lantus before? You have? Yeah, it's for your blood sugars. And we did check your blood glucose level and your A1C. So we will be continuing on this Lantus. Make sure you're getting it every night, okay? So just let you know the side effects of this is hypoglycemia, meaning low blood sugar. So if you're feeling the anxiety, nervous, restlessness, weakness, excessive appetite, making sure you're letting us know and letting your doctor know for when you're discharged. And since you will be discharged on this medication and this does kind of require some supplies, we'll give you some supplies for to help you take your blood sugar at home and then to safely administer Lantus properly, okay? All right, so we'll be doing it on your stomach. Do you mind just verifying your name and date of birth first? Sheldon Cooper, 8/14/90. Awesome. And do you have any allergies to anything? Just latex? Okay, good. My gloves aren't latex. Awesome. All right, so we'll just get on the right or your left side abdomen, you can choose. Okay, let me just wash my hands, scan in my medications. Okay, and I'll talk you through what we're going to be doing so then you kind of have an idea of what we're going to be doing at home when you get this, okay? Just making sure you're rotating the spots around and not injecting the same spot every time, okay? All right. So, I will clean the area, and we're going to uncap. We're going to pinch the skin, go at a 90-degree angle, inject, release the skin when you're pulling out. We'll do a one-handed recap so we don't get stuck. We will deposit this in a sharps container, put on a Band-Aid. Okay, how was that? Not too bad? All right, perfect. So just to let you know, this is not a cure for your diabetes, and this will probably be a long-term therapy. So please make sure that you're exercising and dieting so that your part of helping your diagnosis will benefit you, and we can maintain your blood sugars. A big thing too is making sure that you're getting labs done and your blood sugar taken regularly, so then we know where you're at and there's no fluctuations, okay? All right, is there anything else I can get you right now? No? Okay, here is your call light, and let me know if you need anything. The doctor has put an order for an albuterol inhaler using a spacer now and every Q4 hours for my patient Jean Belcher for his diagnosis of asthma. The order is signed by the doctor. My first medication check is done. Go into the Pyxis. I will pull out my albuterol inhaler. It is not expired, and I will grab the spacer with it. Now I'll go see my patient. Knock, knock, knock. Hello, my name is Raylyn. I'll be your nurse today. I'm here to give you a dose of your albuterol inhaler. Have you ever had this medication before? No? Okay, so this just is a bronchodilation. It helps open up those lungs to help you breathe better when your asthma does exacerbate like this, okay? Just 1 second, let me listen to your lungs, and I'll take your pulse. Okay, yeah, you need to get a dose of this, kind of help you open up all that in there, okay? And then I will take your blood pressure before we administer this dose. All right, so just to let you know, the side effects of this is some nervousness, restlessness, feeling like your heart's beating really fast. Those are just the side effects of these. So things like caffeine will increase those kind of side effects. Otherwise, we'll just make sure to take your dose as directed when you're taking this medication at home. And to start it, I'll show you what to spray 4 times to prime it before you're using it, okay? And we're going to use a spacer to make sure you're getting inhaling all the medication, okay? All right. Can you verify your name and date of birth for me? Jean Belcher, 12/3/2004. Awesome. And do you have any allergies to any medications? No? Okay. Scanning in my medication, sanitizing my hands. All right. So when you're inhaling this, make sure you're holding it in for 5 whole seconds. Okay, I'll count down for you. And so I will put my medication into there. This is what I mean priming. I'll take the cap off, prime it 4 times using my spacer. All right, do one quick big inhale and long exhale. All right, ready? Inhale. Hold it 5, 4, 3, 2, 1. Okay, perfect, and that should help you out a bit, okay? All right, so just making sure you're taking this medication as directed, and if your symptoms don't improve with this medication, then please talk to your doctor because you may need some other medicines, okay? All right, perfect. Otherwise, is there anything else I can do for you? No? Okay. Here is your call button. I will come back to check on you.